Welcome to Medifer. Today the topic is diarrheal strains of E. coli. Let us study the strains causing watery diarrhea and strains causing bloody diarrhea or dysentery. First, coming to strains causing watery diarrhea. They are EPEC, that is enteropathogenic E. coli, ETEC, enterotoxigenic E. coli, and EAEC, enteroaggregative E. coli. Enteropathogenic E. coli causes watery diarrhea in pediatric patients. And there is a characteristic lesion called A lesions. How they are formed? A lesions means attaching and effacing lesions. How they are formed? This bacteria will go and bind to the intestinal mucosal cells of the small intestine with the help of bundle forming bile and leads to effacement of the mucosal cells. Now the microvilli becomes flattened and causes watery diarrhea because there is no absorption. So here you need to remember two no's. There is no toxin, no inflammation, and of course no invasion. And next, enterotoxigenic E. coli. T for T here, it is seen in case of travelers. So it is known as traveler's diarrhea. And the mechanism here is toxin mediated. The name itself tells enterotoxigenic E. coli. So how does this happens? Enterotoxigenic E. coli comes and binds to the intestinal mucosal cells with the help of colonization factor antigen and releases toxin. The enterotoxins are of two types: heat stable toxin and heat labile toxin. Heat stable toxin increases cyclic GMP and heat labile toxin increases cyclic AMP. This heat labile toxin is similar to cholera toxin. So both of which causes increased GI secretions leading to significant watery diarrhea. Okay, so here the watery diarrhea is due to toxin mediated. And the next strain is enteroaggregative E. coli. Enteroaggregative E. coli causes persistent watery diarrhea in case of children or in HIV infected patients. This enteroaggregative E. coli goes and binds to the intestinal mucosal cells of the small intestine with the help of aggregative adherens fimbriae. The adhered rods of enteroaggregative E. coli appears as stacked brick appearance. On Hep2 cell line. So the three strains that cause watery diarrhea are EPEC, that is enteropathogenic. P for in case of pediatric patients, enterotoxigenic, it is toxin mediated and there is no inflammation. And EAEC, it is via aggregative adherens fimbriae, stacked brick appearance on Hep2 cell line. Now coming to strains that cause bloody diarrhea. There are two strains, enteroinvasive E. coli and enterohemorrhagic E. coli. Enteroinvasive E. coli, the name itself tells it causes invasion of the mucosal cells of intestine, okay, via virulence marker antigen and causes dysentery. Enterohemorrhagic E. coli causes dysentery but without invasion. It causes bloody diarrhea without invasion, means the inflammation and necrosis is via toxin. Okay, via toxin. Which is the toxin? The toxin is Shiga-like toxin. Okay, toxin is Shiga-like toxin. Just this toxin itself alone causes inflammation and necrosis, leading to hemorrhagic colitis. And the other point is it is transmitted via undercooked meat. and raw vegetables. And this enterohemorrhagic E. coli has low infective dose, that is less than 10 power 2 colony forming units per ml. And the important serotype to be remembered in HEC is EHEC O157 and H7. It is associated with hemolytic uremic syndrome. It is acute renal failure associated with anemia, thrombocytopenia, okay, due to microthrombi formation. Okay, this is about strains causing diarrhea.